Okay.
One wish for you, one wish for you.
Hey, I made the same mistake again this time around.
What mistake? What's the
Water.
mistake?
I rushed out of the house. I didn't drink water.
Oh, that happens.
Yeah.
What does that do to you?
Well, it can make the voice kind of cracky.
Oh, crack your voice. Tell it not to crack.
In the Braxton.
Yeah.
Good. Yeah, interesting topic you were discussing though.
Oh, you were listening.
Yeah.
Yeah.
Forgiveness and all.
I tell you. How do you forgive somebody who just doesn't give a damn about your own forgiveness?
Ah,
There.
you talk about it and then you create distance.
All
Make
right,
sure it
let's
doesn't
go in.
happen again. Yeah.
That's who we are, Smooth 98.1. We love music, we love life, and we love you. And that's why we're bringing the topic we are about to discuss because it concerns your health and wellness. If you're a part of our YouTube family, you will already see my guest live in the studio and me, of course. And if you're not, please quickly go to YouTube and search for Smooth 91 FM Lagos. Subscribe. You have to subscribe because if you do not subscribe, you'll miss out on everything that we have for you. So please subscribe and click on the notification bell. Afterwards, you can just get a seat and relax. Call all your friends, your family, everybody so that they get to enjoy this information that is about to hit you. And afterwards, please do take it and do better with your dental and health habits. And then I do have in the studio Dr. Deji Kowobari. He's the lead concierge dentist. They're all about bringing the comfort of the clinic to the comfort of your home. No, actually bringing the clinic to the comfort of your home. That's
Yeah.
what they do. And they just check you and inspect you. Lovely to have you join me this lovely morning.
Yeah, awesome being here again. Thank you so much for having me.
How are you?
I'm blessed, doing great.
Okay, so let's go right into it. Dental cavities.
Yeah.
No, not whenever. Not everybody knows what dental cavity or caries is. So please, in the simplest term, just describe what it is and explain it to somebody who has no idea of any medical terminologies.
Okay, I love that term, simplest term, because
Yeah.
that's one of the things I like to do. Try to demystify dentistry, break it down to the layman so that it can be understood. So, dental caries or cavities, like you already called it, it's permanently damaged areas of the teeth that are caused as a result of the release of acids by naturally occurring bacteria in the mouth. Okay, so I'm going to take it one after the other and
Yeah.
then go over it again. So dental caries, once they are formed, are permanent. They are irreversible, and then they are caused as a result of the production of acids by naturally occurring bacteria that are in the mouth. So how do these acids come about? They are bacteria in the mouth normally, the way the mouth is structured, naturally occurring bacteria in the mouth, and they are supposed to be there in order to just keep the natural microbial environment normal. And then when we eat food, remnants of our food, they act as what we call substrates. They just act like sources of food for the bacteria. So the bacteria act on these remnants, and in turn they release acids. It is these acids that break down the structure of the teeth. So when they break the structure of the teeth down, they cause holes. It is these holes that we call dental cavities or dental caries. Yeah, so in simple terms, as much
Thank
as
you. That's
possible.
simple
Yeah.
enough. Now let's talk about how sometimes you just wake up. If you're lucky to wake up and see it yourself, because a good number of time, not everybody gets to see it themselves, except they now start to complain of pain, which I think is already at the late end. But let me
Yeah.
not jump ahead of myself. So,
Okay.
how does this thing happen where you just wake up and see the whole, the acid, as you've already explained? Is it that over? Is it gradually it starts to break it down, or there can be just one very large or huge secretion and it just drills that hole in your
So
tooth?
it's very gradual. Like before you can discover a hole on your tooth, or before a dentist could possibly say you have a hole on your tooth, depending on how large it is, it could take months, it could take years for the holes to form. So it's a very gradual process. And the reason is because even the saliva in the mouth, they contain some minerals that help to build the structure of the tooth, if I can use that terminology. We call it remineralization. So the teeth have minerals, more like the blocks that build the teeth. So when we have saliva in our mouth, or we even use some of these toothpaste products, they help to encourage kind of blocking of some small pores that might have been created. So but it is when the rate of demineralization, which is the breakdown, is higher than the rate of remineralization that a hole forms. So before a hole forms on the tooth, it takes a long time. And again, one of the things that can then make holes form. So I've talked about the cause. There's just one major cause of hole formation on the tooth.
Okay.
One, which is the release of acids that break down the structure of the tooth. But there are a lot of factors that could encourage or hasten that process. So, for example, and that's where our habits come in. So, for example, when you eat sugary stuffs a lot, or some foods that can be sticky on the surfaces of the teeth. So even if the minerals or the substances in the saliva are trying to help to remineralize the tooth, you yourself, by the time you're snacking at night or during the day in between meals, you are taking a lot of snacks, junks, and all of those things, they're overpowered. So the breakdown of the tooth structure then increase. So to answer your question straightforward, it's almost rare for you to just suddenly wake up and you meet holes on your teeth. You understand? So it's very gradual.
So they're usually behind the scenes.
Exactly. Yes. So there are some times when I could check a patient's mouth and I see some dark lines on the back teeth, most especially the molars. That could be a pointer that caries formation has begun. Yes, on the teeth. That could be a pointer. So if care is not taken and if it's not reversed, then it can go deeper.
Okay, you know what? We'll use a case study. We have a case study on WhatsApp, and that's
Interesting.
Ali. Ali says, "Good morning to you, Oluwaseun. I've been looking forward to breakfast in bed since I saw the lineup on Smooth WhatsApp status." Well, thank you. And he says, "Hello, Doc. I have holes, not one, no, holes on all of my molars. The major cause is tooth overuse. I have read much on the situation too. I used to go hard on myself on my vegan days. I literally will buy fresh bunch of celery or mint leaves and every other kind of leaves and munch on them for minutes. Sometimes when I'm binging on movies, I could go snacking on a whole coconut or cane sugar or fresh bunch of tiger nuts for the duration of the movie. Just anything to keep my mouth busy and convince me that I am not hungry. The problem now is my teeth is now sort of weak from the overuse, not decaying, just the holes in the molars. These days I drool easily at night, which can be a bit uncomfortable for me. I can't eat tarty fruits like soursop or pineapple or tamarind or as little as agbalumo when I have had a brush of my teeth. It will be that the brushing of teeth heightens my tooth sensitivity. The only thing that works is anything non-crunchy, oily, or greasy foods, which I am not a fan of. Number one, how can I correct this, doctor? And number two, is it very expensive to correct? Thank you so much. Now hold on. Take a deep breath, a very deep one. We will take your answer. Just begin to mule on everything that you're telling Ali. We will come back to take that. And you can also join the conversation if you have a question or you have something that you want the doctor to help you prefer solution to here, of course. And the number to send your WhatsApp message to is 0809 But the line to dial is 01 448 9981. Stay with us because we'll be back.
Interesting. Can you please just scroll up a little bit for me?
Okay.
He has a combination of a lot of
He
things. Not
has.
decaying, just the O's on the molars.
That's
It's
why I
kind of
said.
contradictory.
That's
But
why I said is the case study for today.
yeah, that's a good one. It just came in, right?
Yeah, yes.
Someone said pray for the
No, no,
person.
that's for the forgiveness
Oh,
thing.
okay.
Yeah.
Ah, jeez, I thought it was this. Oh, God.
Yeah.
So go ahead and get your sparkle on with the new Nestle Pure Life Sparkling Water.
University really helped me secure the graduate employment.
Had support from my module leaders.
I love Comet University and all facilities.
Would you like to find out more about what it's like to study in the UK? Join the free event organized by Coventry University on Saturday, March 5th, 5 to 7 p.m. in Lagos.
Register today by visiting www.coventry.ac.uk/Nigeria.
What we're going to do right now is to
Let's get it on.
wait, back to timeless music.
Let's get it on.
With Motown great
Marvin
hits from
Gaye.
as far back as the 70s. Marvin Gaye, The Temptations, Gloria Gaynor, Gladys Knight,
And this scarcity, I don't even
The
know.
fuel scarcity?
Yeah, it's like it's going down, but later it looks like it's coming back.
They're confused. We're coming back in.
Okay.
When you tune into Motown Monday on Strictly Soul every Monday on Smooth 98.1, you can be sure that the music will move you. But right now, you are tuning to Breakfast in Bed here on Smooth 98.1. My name is Oluwaseun. My guest is Dr. Deji Kowobari. He's the lead concierge dentist NG, and we are talking about dental cavities slash caries, meaning hole in the tooth. We have a case study. Thank you, Ali from Apapa, for allowing us to use you as the case study. Of course, he's going to answer your questions. So let's start with that.
Okay, very interesting case study here. This is going to help a lot in our discussion because when you're practical about things, you
Yeah.
can drive home the point some more. So you said here that so the first thing you would have to see from this is that there's a lot that has to do with habits when it comes to dental stuffs, and then you say that you think that your teeth are weak because of overuse. Well, which you can say that you can be correct, and then that there are holes on the molars. So looking at a list of all the fruits you've been munching on and crunching on all these years, I can see two major things that can affect the teeth. Number one, sugar from these fruits. When we talk about food substances that could um, predispose one to caries, you may think of normal food, carbohydrates, crunchy stuffs, and all of those things. But these ones also contain a lot of sugar, or coconut, cane sugar, fresh bunch of tiger nuts. You've been bombarding your teeth with a lot of sugars all this period, and then the period when you were eating it also in between meals or late at night could also worsen the situation. So depending on the age too, I could imagine that there are holes on the, so you saying not decaying, just holes on the molars could be contradicting, although it's possible. And then there's a lot of sensitivity too. So let me just quickly go to the question, which is that is this can this be
How
how
can I
can you
correct
correct
this,
these?
doctor?
Okay, the first thing to do is to see a dentist. Whether you go to the dentist or the dentist comes to your place, like we do at Concert Dentist NG. So the dentist needs to examine your teeth. So when we want to treat patients, before we arrive at what to do, there are three things we do. Number one, we take history. You supplied me with history, fantastic. The second thing, then we do an examination, which can't be done obviously now. So that's why I said you have to see a dentist, or a dentist in to see your mouth, examine you. Then the third thing is to do investigations. Most likely, we would have to take X-rays of all of the teeth involved to know the extent of the damage, the extent to which the holes are on the teeth. That is what is going to inform the kind of treatment that would be done. You have sensitivity on your teeth, so depending on which part of the teeth are exposed, that will determine what kind of material or what kind of treatment that will be done to cover the exposed part. Because all these foods you've been taking all this while, they have caused, they possibly will have caused what we call chemical abrasion on your teeth. So apart from holes, which sugar could have caused, there could be the possibility of abrasion where due to friction rather, or erosion rather. Yeah, I think that's a better terminology to use. Chemical erosion on the teeth, where those substances from the fruits have been wearing down the surfaces of the teeth. So the way to correct it is to see a dentist. You supply the history, the dentist does examination, and then we do investigation and we draw up a treatment plan. The second, which is the interesting question, is it very expensive to correct? Expensive is relative. Yeah, what's expensive to me might not be expensive to you. So like I said, there will be treatment options. One of the major reasons why people don't go to the dentist or postpone their dental appointments is they have this mindset that it's expensive. But the first thing I usually ask people is, how much is it? You can't tell me something is expensive if you don't know the exact amount it costs. So the first thing you have to do is to go, know what it costs. And then the interesting thing for a case like this now, because of the way dentistry is, you've gotten to this point because of habits you've had over months or years. So we also know that we can't solve everything in one sitting. We can have a treatment plan that could last months or even up to a year. And so if it could cost you a lot of money over a long period of time, the payments and treatments could be broken down to phases and stages where it doesn't cost you a lot at once. So I can't tell you if it's expensive to correct because I don't even know the exact treatments you're going to do. But what I can tell you is, if possible, today, see a dentist. Yeah.
Well, Ali, you already heard it. I think anything that is hampering or interfering with your good quality of life is already expensive on its own. So do not think of the cost, because I want you to keep calling and to keep listening. And one thing about tooth pain and aches is that thing is very, very painful. Super painful.
And the longer you wait, the more expensive it gets.
Okay.
Yep.
So you heard that, Ali. Please seek out a dentist. Please and please, because we care about you and we don't want you to be in pain because you always have to listen. But yeah, seek out a dentist and get that corrected. Now, you have already extracted some of the possible causes of dental caries and cavities from Ali's case. But then, aside bad habits, and in fact, break down the habit aside you eating sugary things and not brushing afterwards, right?
Yeah, poor oral hygiene also.
Okay.
Because when we eat, remnants of food remain on our teeth and bacteria are happy. They are seeing something to act on. So we need to clean them off. And that's where the habit comes in. Brush twice daily, floss at least once daily, and then see your dentist at least once in 6 months. Because it's interesting how you check a patient March 2020 or March 2022 rather, and and the teeth are clear, you just clean for the patient, and something like maybe December 2022, you have like two O's that have started on the teeth already. The patient doesn't know, but the habits the patient have, gone through or exposed him or herself to over the period of time. So you could ask the patient, what has changed within the last 8 months? Could tell you, oh, I had an exam for a period of time where I had to stay awake at night, so I had to eat a lot of stuffs, just to keep awake, and it could cause damages. There are some patients that come down with all and they've traveled out and they've changed diets. So what they are used to here, and some of those stuffs over there have a lot of sugar and all, so poor oral hygiene habits, systemic stuffs too, systemic conditions,
Ah.
yes, could predispose, could increase, because I talked about the importance of saliva in trying to prevent caries. So there are some conditions that could reduce the rate at which saliva is produced that are systemic. There are some conditions that could reduce the quality of the substances in the saliva that help reduce the possibility of caries. So those are systemic conditions that could also predispose one to caries. And there's also malocclusion. If the teeth are not well arranged, it could make calculus gather a lot, and there's a lot of bacteria inside the calculus. So there are a lot of conditions. People who have like possibly special needs children who have some musculoskeletal issues that could reduce their possibility of maintaining a proper oral hygiene. People in extreme of ages. So those are some of the things that could cost.
That's interesting.
Yep.
I have a message from Muyiwa on WhatsApp saying, "Good morning, guys. The gentleman is very correct. Teeth treatment is not very expensive. I do my scaling and polishing twice a year, and it's 20K per session. That's 40,000 naira a year. I am sure it's cheaper in other places. We should do more to keep our teeth healthy." Thank you for that message on WhatsApp, Muyiwa. And you can also be a part of the conversation. Send your messages if you have a question or something you're not very clear about, or maybe somebody told you something that you think is a lie. Well, the dentist is in the house and you got free consultation. The number is 0809 444 0981. That is the WhatsApp, 0809 444 0981. But the call line is 01448 9981. Again, 01448 9981. Please ask your questions now so that you do not believe what that person on the street is shouting and telling you that, come and buy this substance, come and buy that substance. It will get the. I hate those things. I
God.
absolutely hate those
So
things.
talking about
I
things
think they
that
should
could
be
be
arrested. Yes,
talking
because
a-
they're posing danger to health.
talking about things that could be like lies, we call them myths, and then I like to debunk myth. So there are a lot of times when people come to the clinic and they ask you if it is true that O's jump from one tooth to the other.
Hold that thought.
Okay.
That sounds ridiculous. Hello, good morning. Good morning. Your name and location, sir. Thank you for calling. Do you have a question? For how long has this been?
Okay, so the same way a lot of things could be happening, but the same way we have caries affecting adults, we also have caries affecting children. So a 4-year-old could have O's on his or her teeth. So it could be caries, and like we always advise, you could take a child to the dentist. If you can also check into the mouth of the child, it's easier to even check. And if it's caries, you could possibly see a dark spot on one of the back teeth or a cavity that has already formed. So it's possible it's caries. Yes. Yeah.
Thank you.
You're
You're
welcome.
welcome. All right, so let's jump back to holes jumping from one tooth to the other. That sounds ridiculous, absolutely preposterous.
Yes. So you have a lot of people. You have a lot of people, most especially when okay, so it started with this myth of when you extract one tooth, you keep extracting the others. Yeah, so we dentists get that question a lot when we get to a point where there's no other option again than to extract a tooth. And by the way, it's not all teeth that have holes that need to be extracted.
Oh, okay.
Yeah, there are other solutions depending. Like I said, when we're talking about at least case study rather. When we do an examination, or at times when we do a physical examination or an investigation like an X-ray, it's going to show us the extent of the damage done. So if based on science, we see that this tooth is restorable. That's the terminology we use. We can restore it back to its normal form and function. We would restore it. Just that at times, the financial implication of the restoration actually at times could be like times 5, times 10 of extracting. So that's why a lot of times people in this part of the world tend to pick extraction. But a good number of people still do restorative procedures. A good number do restorative procedures. So when people, there's sometimes when no matter the amount of money you have, you still have to extract the tooth because it's so damaged. We call it grossly broken down teeth.
That doesn't sound good.
Yeah, grossly, like
That's
if
the end.
yeah, like if the crown of the tooth is 100% and the crown left is just like 10%, there's no magic
it
anybody
out.
wants to do. So
All right then.
Yeah.
Hello, good morning. Please call back
Lazar.
if you can.
Okay, so when people ask when we want to extract for someone and they're like, so my mom told me or my sister told me that if I extract this one, I'll keep extracting. The first thing I ask that person is, your mom a dentist? And the person goes like, no. So I'm like, okay, I am a dentist. Would you believe me? They said yes. So because the teeth, let's just take an average adult, for example. I have 32 teeth. The teeth are individual units. Yeah, so On the surface they are not connected, although beneath through they have like a connection of their nerves and blood vessels that run down to the remaining part of the body, but on the surface they are really not connected. So if you have a hole on a tooth, the hole can't jump from one tooth to another. So a typical example is when a patient comes to the clinic and says, I have a hole on a tooth and this hole is seriously painful. When the dentist checks your mouth, the dentist doesn't just check that tooth alone. It does what we call a general oral checkup. Checks other teeth in the mouth. So there are some times when the tooth that is painful, the tooth is painful because the hole has gone so deep. One or two other teeth in the mouth might have holes that are still at the level of the enamel. I've never mentioned that since morning. And at the level of the enamel, there's no pain because there are no nerves and blood vessels. The dentist most of the time will tell the patient that there's a hole on this tooth. I think it's good for you to take care of this one also while we are taking care of this. But the patient will be like, no, 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 this is the one I came for, blah, blah, blah. I just wanted to treat it. The dentist will be like, okay, we'll do it, but come back in like a
They'll
month
not
or
come
two.
back.
But they won't come back.
And so not say jumped.
Exactly. So when in like a year that hole has gone deeper, and then it then brings you back to what brought you initially. Psychologically, you want to conclude that
It jumped.
but it didn't.
I am sorry I'm laughing at
It
this. I
didn't jump. It
mean
didn't
to.
jump.
I see the phone lines buzzing, but
Yeah.
we'll take the calls and messages that we can after this one. Please stay with us. We're still talking about dental caries and cavities with Dr. Deji Kowobari. Jump will call. Jump and
Because it's the same habits that you have that led to holes on one tooth
Yeah.
that will lead to holes on another. So the interesting thing about dental stuff is that you can't remove habits from what we do in dentistry. It's impossible, and things take a long time. Before they you see people asking things like, can you inherit caries
Now you inherit Guinea.
or bad teeth? You can't, because even if you have a set of twins that were born on the same day and they have their lives that they're living separately, one could have a bad set of oral
Yeah.
hygiene and the other could have good, depending on the habits that they've exposed themselves to over the period of time.
That's interesting.
Hey, this Ukraine thing,
Oh my word.
For those who want to make the right choices every day, choices that bring out the sparkle in you, and those that are inspired by you. The new Nestle Pro Life Sparkling Water is made just for you. So go ahead and get your sparkle on with the new Nestle Pro Life Sparkling Water.
Okay. And not just the music, we got the great talk for you, and of course, the information, education, and everything that concerns your wellness and health right now, because we're talking about dental caries and cavities, the causes and how you can prevent it. We have talked about that in between the lines, and I hope that you have been able to extract them. I still have Dr. Deji Kowobari in the studio, and quickly, I have the space for just two calls. Okay. Hello, good morning. Hello, good morning. Your name and location. Do you have a question? Okay. Good morning. Yeah. Okay. Thank you.
Okay, so yeah, if you have caries in between two teeth, interdental caries, that's one of the reasons why we always say you should floss, because the floss helps to remove remnants of food that could be hiding in between two teeth. Yeah, so interdental caries can be treated. There are techniques to take such a hole out of the tooth and then fill it with the right filling material.
Hello, good morning. Good morning, your name and location.
Okay, you're welcome.
Okay. Yeah. Okay. You're welcome, Ali.
You're welcome.
All right then. Yeah, I think teeth whitening also can predispose you to temporary tooth sensitivity, if I'm correct.
Yes, it can.
Okay. All right. One more space for one more call. 014489981. If you have a question or something you quickly want to clarify before my guest takes his leave. Okay. Last caller then. Hello. Good morning. Good morning. Please turn down the volume of your radio set. Hello. Have you done that? Yes, I can. Your name and location, please. Okay. Go ahead. All right then. Thank you. He'll definitely answer your question. Thank you for calling.
Okay, if you describe that as something aching as if you're eating block, that's very close to tooth sensitivity. It could be because of the kind of brush you're using. If your brush is too hard, it could expose the root surfaces, that's wear down your gum, and then the surfaces of the teeth, of the roots rather, are more sensitive than the enamel. So it could be your brush. If your brush is hard, I would advise you change it to a medium texture toothbrush.
Thank you so much. Now that we are done, we are totally out of time. What will be a general recommendation? And for people who have many more questions on their mind, but of course, this cannot fully fix it, what will be your general advice?
General advice: make visits or hosting of a dentist or visit to the dental clinic regular. It's generally advised that you go to the dentist at least twice in a year, but I usually say at worst once in a year. If you've not seen a dentist so far this year, we're entering March very soon. You could schedule an appointment for March. There are a lot of very, very good dentists, my colleagues here under the Nigerian Dental Association and also private dental practitioners in Nigeria. We have platforms on social media where you can link up with dentists and then, as much as possible, make dental visits part of your plans and then make sure you meet up with your appointments. Thank you very much.
And in addition to that, the truth is you can ask all the questions, but until you get a one-on-one visit and then they get to know what is wrong with you, examine, ask you questions about many things, you might not get the help that you need. So that's one of the very important reasons you have to visit your dentist. And like he said, you can host a dentist, meaning the person can come to you. We are in the 21st century and everything is already easy. So yes, you can have a dentist come over to your place. And that's one of the reasons you can also reach out to Dr. Deji Kowobari on Instagram and on Twitter. Also, you can check out Concierge Dentist NG on Instagram and Twitter and ask them the questions or whatever it is that you're concerned about. They'll be willing to take that any day, anytime. I can personally testify to that. So, ladies and gentlemen, thank you so much for being a part of the segment. We are thankful for your calls, for always staying there. Like I mentioned all the time, you're the reason why we're here. So, thank you so much. Please take care of yourself. 8:40. It's the time for the kids, and I'll be joined by the kids in the studio. Great time. You can stream live on YouTube, www.youtube.com/smooth981 FM Lagos.
Okay. Awesome one.
Thank you so much. See you another time.
Yeah. When next would that be?
Maybe next month.
Okay. This is my last. Well, my last Saturday next month is fixed because of our boot camp.
It doesn't always have to be last Saturday.
Yeah, it doesn't always have to be
Yeah,
last
it
Saturday.
could be anything.
Yes.
Yeah. Thank you. Let me end
Okay.
the stream and see you all.